We are live on Facebook. Hello, everybody out there in social media land. We are here again, the Flint Public Health Youth Academy, for another episode of A Youth Perspective. We are so excited to be with you all again on this evening as we continue to talk about those issues, those concerns that are public health related, which is almost everything, as we look at the impact that public health has on our everyday life. So you know our perspective and you know our motto, public health is everything and everything is public health, right? And so we will be launching this year in 2023 our national gun violence campaign, health messaging campaign. We will start that probably around the end of April and March, but for the next 2 months, we really want to highlight the conversation around what is known as long COVID, right? And it's really what happens to individuals who have had COVID, but who are now having these long-term issues health-wise since they've had COVID. And this is important to us, number one, because we know that there's talk that the COVID emergency will be lifted nationally. There's also concerns around the fact that if people have not gone out and gotten their vaccinations now and get it before it's lifted, they'll have to pay for it out of their pocket. There's a lot of things happening, and we still have people in the hospitals on ventilators due to COVID. It's not over. And so we want to make sure that as public health ambassadors, that we do our due diligence to make sure that we educate our community and our young people as much as possible, because we know young people are not the voice of tomorrow, they're the voice of today. So with that, welcome to our show. We have a wonderful show. We have some very special guests today, but I want to kind of start off with just our public health interns and then our mentors and staff, just saying hello to the people. Go ahead and greet the people. Go ahead, Kayla, tell everybody hello. Kayla. Shannon.
Hey people, it's great to be back here in 2023 and happy Black History Month while we're at it. My name is Kayla Shannon and I am a junior at the illustrious Spelman College in Atlanta, Georgia. And I am a third year intern, I believe. And I'm going to pass it to Tomas.
Hello, everyone. My name is Tomas Teo. Glad to be here with you all today. I am a senior at Genesee Early College with the University of Michigan, Flint, and I pass it on to Cole.
Hi, thank you, Tomas. Hi, my name is Cole Mays. I'm a Flint native. I'm currently trying to get into the University of Michigan. I've been in FPHYA for around 2 years, and I'll pass it off to Amir.
Hi, hello. I believe in Flint, and then this is my 4th year of FPHYA. Think about that. Yeah, it's great to be back.
Who's next? Go ahead, Melody. Come on and jump in.
Hi, everyone. My name is Melody. I'm a 13th grader at Genesee Early College, and I'm excited to be on with everyone.
All right. And then we have some wonderful mentors. Briante?
Good evening, everyone. My name is Briante. Going on 3 years here as a FPHYA mentor. It's a pleasure to see everyone. And looking forward to a wonderful show. We're about to talk about long COVID. Yeah.
And we have the future Dr. Khalil Calvin.
Hey everybody, I'm Khalil. I'm a MD1 at Morehouse University, and I'm Morehouse School of Medicine, my bad. And I'm so glad to be here talking about these after effects of COVID and how we'll have to deal with those as future practitioners of medicine, how that'll look like.
Wonderful.
And I'll pass it to, who has it on yet?
Kiera. Flintstone, all the way on the East Coast.
Hi, everybody. My name is Kiera Wallace. I'm a third year at University of Maryland School of Law. This is actually my 2nd year, not my 3rd year. I started in 2021 with FPHYA. And who has not gone
Pass it to Monisha.
Okay, Monisha.
It's on mute. Oh,
okay.
There you go.
Okay. Hi, I'm Monisha. I've been working with FPHYA. I'm one of the mentors and staff, and I've been working since 2017. And I'm excited to hear what's going to be said in this show today.
All right. And then we got the Dr. Vanessa DeDanzine.
Hi, how are you? Hello, everyone. I'm glad to be here. To be one of the mentors for the FPHYA in Flint, Michigan. I'm excited to hear what the topic is going to be today for long-term COVID, and I'm also excited to be involved in the initiative that they have for 2023.
Wonderful. And then the Reverend Doctor, right, Reverend Dr. Bailey.
Good evening, everyone, and it's great to see all of you. I've been with Flint Public Health Youth Academy since
before there was one.
Before there was Academy. But I'm just grateful to see where this Academy is growing and going to. Monisha and Khalil, remember when we used to carry everything in? Yeah, so we've been doing this for a little while, and I'm just grateful to see all of you joining in with us. And I know that Dr. Vereen today will give us a great understanding of what long-term COVID is really all about.
That's right. And then Nurse T is going to really tell us how we need to engage and share those messages, on the streets where people are who don't live in the world of medicine. So with that, we have two wonderful individuals as our guests. We have Nurse Tarnesa Martin here in Flint. We love her and call her Nurse T affectionately. Go ahead, Nurse T. Go ahead and greet the people.
Hi, everybody. My name is Tarnesa Martin, aka Nurse T. I am so excited to be here, and I look forward to an awesome, amazing, wonderful time. And we are going to activate our healthcare power.
That's right. And then we have the Don.
The Don.
Reverend, no, not Reverend. Dr. Don Vereen.
What a team. What a team. Nurse T and the Don with the Academy. Thank you, the Academy. Yeah, it's great to see everyone. I'm a public health doc at the University of Michigan. I'm based at the School of Public Health. I'm vibrating a little bit here. And I've been doing research for a number of years. I've been doing health and drug policy for a number of years, most of that in the federal government. And now I spend most of my time doing community-based biomedical research projects. And so I'm happy to be here, happy to see everybody again.
And Melody, did I skip you? I didn't? Okay. Great. So we got everybody in. And so right before we get started to have this wonderful conversation, and just for the audience to know, this is more of an education where we're kind of learning all together as a village about long COVID. And next week, our youth interns will really just kind of dissect what we heard, not next week, at the next show. We would dissect what we heard and really try to think about ways that we could be effective in getting the messaging out there and how we can engage the community. But before we get started, I would be remiss if I wouldn't say, especially to our Flint community viewers, that there is a boil water advisory out right now in the city of Flint. So please do not drink the water. Don't cook with the water. Don't take a shot. Boil your water. They say at least for a minute minimal, but there is currently a boil water advisory out, and you can find more information on the City of Flint website. So please, if you're listening to us and you live within the City of Flint, please boil your water. All right, with that.
Please stick to bottles, please.
Yes, yes.
In addition to boiling your water, if you boil the water, please, after you boil it, then filter it.
Right. Please do that. And they're also saying that after the boil advisory is lifted, because filters don't get all the bacteria out, you need to then change your filters. Because the filter could actually be breeding bacteria. So we want to make sure that our residents are safe and that they're in the know and that we're sharing relevant information. The advisory went out earlier today around 10, but some people still don't know and still are not in the know about what's happening with water in Flint today. All right, with that, we're going to talk about long COVID. So people are COVID out, right? People are saying a lot about, COVID is over. We're ready to embrace this new normal, whatever that is, right? And then people are at a place now to where we really want to go back to doing a lot of in-person programming, a lot of in-person engagement, etc. But before we get started today, we kind of want to just remind people because unfortunately, when things are not in our face, quite often we forget. So just a reminder that in the United States alone, we've had 1.12 million deaths due to COVID and 103 million cases due to COVID. Again, 1.12 million deaths in the United States and 103 million cases up to today, literally, due to COVID and its impact. And then worldwide, we had 6.85, so roughly 7 million deaths worldwide and 672 million cases. It's important that we ground ourselves in that because we don't want to forget about those are not cases and just numbers. Those are lives. Those are people's loved ones. Those are mothers and fathers, sisters and brothers and sons and daughters, cousins and friends. And so we want to make sure that we keep the humanity in this discussion about what those numbers mean and represent. And so today we want to talk and get educated on what the concept of long COVID is, what it is not, what does it mean? Some people have heard the term, some have not. Some people have been impacted by it, some of them have not. And so we want to really just open up this dialogue and this educational engagement around that. So Dr. Vereen, you want to lead off with your presentation, and then we'll have Nurse T give us her talk about long COVID, and then we can kind of have some dialogue about it. So Dr. Vereen, you have the floor to share your slides.
Sure thing. And for the sake of time, I'm actually going to be very short so that we can have a conversation and to make sure that Nurse T gets the information that she wants out. And if I leave anything out, I can always go back. Now, having said that, and I'm going to share my screen in just a sec, I want to thank you, Dr. Key, for lots of things, but in particular, your introduction to this is absolutely wonderful. The American public is not thinking about this in a way that is going to help us live the rest of our lives. We're already living with a number of health issues. And as far as we know, they started out like this. They killed us as human beings, whether it's a bacteria or it's a virus or a fungus. Things killed us. And then we developed immunities to them. So you all will remember, if you knew your history or if you hadn't been taught your history, remember this. When the Europeans came over to this continent, they killed a lot of Indians before they started shooting them with the bacteria and the viruses that they brought to this country or to this land that the Indians, the Native Americans, did not have immunity to. And so that's why I'm glad I'm going to do the presentation the way I'm going to. Yeah, there are a list of symptoms, and I could explain all the symptoms to you about long COVID. Instead, I'm going to give you a little bit of a lesson in viruses and infectious diseases. Because if you understand that, not only will you understand long COVID, but it'll be a little clearer how you're supposed to deal with that. Not only physically, but in terms of your attitude, because it's attitude that is going to be the most important. So having said that, let's do.
And while Dr. Vereen is pulling that up, everybody on the panel and everybody listening on social media, Facebook, please like and share the live feed right now so everyone would know that the Flint Public Health Youth Academy is live. Go ahead, Dr. Vereen.
Okay. So let me first say that there are viruses, there are bacteria, there are fungi or molds, and then there are things that are kind of combinations of each of those that can invade our bodies and cause illness. Our bodies function when everything is happening at some kind of equilibrium. And viruses like bacteria, sometimes people, can upset that balance. And in the case of the coronavirus, we have a new virus. They called it a new virus, something that we hadn't heard of before. Now, in terms of viruses, this title slide that I have, I picked this image so that you could see that there is a crown on the outside of this virus. It's actually three-dimensional. It's like a golf ball with spikes sticking out as opposed to indentations. And not all viruses have an outer coating. If you look at this image, you'll see some curlicue things inside. Those are nucleic acids. Those are mirror images of DNA, the DNA that defines this being, this virus. And the nucleic acids are ribonucleotides. It's a mirror image of DNA, deoxyribo. But some viruses, many viruses that we have experienced, like when we have a cold, are just the genetic material floating out in space. There's no protection. And the dirty little secret about these viruses is whether they're RNA or whether they're DNA, they do not have the ability to replicate on their own. So that's why they have to get inside of a cell and use the machinery that a cell has to replicate itself, to replicate the DNA and then start a new cell. And what viruses do is they get into the cell to hijack that machinery so that they can propagate, so that they can replicate. This virus, it's called the coronavirus because it looks like it has a crown. It's got all these spikes on them. Those spikes is what it uses to get into the cell, to get into your cells. We'll begin with that, and then I did prepare a slide so you know what I'm gonna cover. We'll go over what a virus is. I'm not quite done. We'll talk a little bit about how it infects us. I did start that. We're going to talk about what the COVID symptoms are. We're going to talk about what those symptoms mean, what's going on in the body. And then once you understand that, a lot of what is long COVID will become pretty obvious. And then we'll end on a positive note with some, if you get long COVID, with some basic things that you can do, because the COVID virus, if you survive it and it doesn't kill you, you may have to live with it for a while. We don't know how long yet because it's only been 3 years since we've been able to interact with this virus. So one last thing about the virus itself is that when it was discovered that this coronavirus was starting to infect people, there were folks who had been studying mRNA viruses at NIH starting 25, 30 years ago, fortunately. And they knew that the proteins that make up the crown, those spikes, were unique. And they started to develop proteins that could eat them up. And so all of you that have been vaccinated, you have been given a package of a little machine that makes an antidote to those spikes. And as the virus changes, it's like tomorrow I won't be wearing this shirt because I'll change my clothes. It isn't because I mutated, it's just because it's another day and I'm wearing fresh clothes. Well, the viruses can change from the inside the more and more they replicate, and they change their clothing, they change their outsides. And so the new vaccines, the boosters that they keep developing, is to be able to attack those spikes. I'm going to add one more point. Many of us have had COVID. We developed an immunity when we were exposed to that virus, not only to the spikes, but to the outer coat, to the RNA. We developed ways to attack and kill and eat and chew up those other parts of the virus as well. And that's why some of us have been saying, well, you know, if you've been vaccinated and you get COVID, you know, there's a possibility that maybe your immunity is a little stronger than others. The research hasn't proven that yet, but I'm making that point to underscore what I've just tried to teach you in the last 4 minutes, which is a lot about viruses. And I can come back and we can talk in more detail if you have interests. But I found this pictorial here, and I can give my slides to folks if they want to be able to have them. But basically, the coronavirus attaches itself to a cell. It's able to get into the cell, and it releases its DNA or its RNA, because it's an RNA virus, not a DNA virus. That RNA, if you look at number 4, actually gets into the nucleus of a cell, and it uses the machinery to replicate itself. The RNA has to be made into a DNA strand. That DNA strand has to be replicated. And then that once it's replicated, that DNA strand makes an RNA strand, a mirror image of it. And then that gets repackaged. That's what those purple circles are. And then the RNA makes the outer coat. That's the RNA is the combination, or the combination to tell the cell to make that protein coat. So it's got the spikes, and then it has to use those spikes to get out of the cell. So 2 important points here. Sometimes those cells that release the virus are killed. Sometimes they're not killed, they're injured, and they have to be repaired. So if you can remember that, the virus is going to get into your lungs, and it's going to burst out like the alien monster. And it might kill you, kill the cell, or you might survive it erupting. The cell might survive the eruption. And then all those new viruses go out to find somebody else to infect, just like the alien monsters, if y'all are familiar with that movie. So hold your questions. I hope you've grasped that basic work. This is just another way of looking at it. And then I want you to know that I'm using these pictures, but we've been able to see this. We have real pictures of what this virus looks like. I want you all to be impressed by the science, the level of science that we have out there. And these red circles are the virus approaching some cell. They're getting through and they're inside the cell, and you can see many of them getting in. I don't have a picture of them getting out, but it's an invasion, and it's happening at the cellular level. And if you could remember that now, that happens with every virus. Every virus has its way of getting into a cell. And then every virus hijacks the DNA in that cell to help it replicate. And then when enough of them get made, then they either burst out or they figure out a way to get out of the cell to do it all over again. Each of those new individuals wants to replicate itself all over again. So you can imagine, I mean, when you think about it, when you get the flu, any of us who've been unlucky enough to get the flu, your muscles are just achy. It's like you can't move. That's because the virus, that particular virus, the influenza virus, does like muscle. And it goes in and it is bursting muscles all over the place. That's why you're so sore. That's why you have that symptom. So every time you have a symptom with a particular organ, it's because that virus has been getting into the cells in that organ, replicating and injuring the cells, if not outright killing them. Okay. So in the lungs, the coronavirus is breathed in. That is the first and main area that we see the virus infecting. When you breathe, believe it or not, a lot of air goes into your stomach. So diarrhea is one of the symptoms of COVID. And that's because the virus gets into our gut and it attaches itself to cells in the gut, and it either kills them or maims them. And it keeps doing that until we can figure out a way to wash them away. And oh, by the way, when the virus gets into these cells in the lung, they find their way to our bloodstream, because the lungs is where blood gets oxygenated. Blood carries the carbon dioxide that gets released back out into the air. And when you breathe in, you're breathing in oxygen. And then that oxygen is exchanged for the carbon dioxide on those red blood cells. And once these viruses get into the lung system, they find their way into the bloodstream. And that's why the virus ends up all over the body, which means it can infect anywhere it ends up, anywhere that the bloodstream takes it. That's why there are so many different forms and different symptoms for long COVID, because they go everywhere and then they don't necessarily leave right away. It's like, sometimes relatives will come and visit and they'll overstay their welcome, and you want to be able to kick them out, and it hurts when they're taking up space in your house. Um, the other way to think about this, if you've had too much to drink, many people have a hangover. That's because when you drink too much and the alcohol doesn't just stay in your stomach, go to the liver, gets digested by the liver, and then is neutralized, if you overwhelm that system and the alcohol goes to the brain and you feel it, it turns on the pleasure center, but it also invades cells. That's why people who have a heart condition shouldn't drink, because the alcohol gets into the heart. And the digested alcohol, it turns into an aldehyde, and the aldehyde collects into cells in the body. That's why you have a headache when you have a hangover, because the aldehydes are in the muscles that cover your head, and that's the basis for a headache. You have slurred speech when there's too much alcohol. There are all these other symptoms. That's because of the direct effects of the alcohol. And it's the same with viruses. They can go everywhere and invade almost anything. So that can happen in the lungs. That's the first place. So for COVID, we have fevers and chills. That's because anytime there's a foreign thing in the body tries to burn it out, basically. By making the body's temperature higher, it may be too hot for the thing that the body is, that's invaded the body. Because your lungs are being damaged by the virus, you'll have a cough. You'll be short of breath because when some of those cells are either maimed or killed, you can't exchange oxygen very well. So with this disease, one of the first things they do when you come in and you're short of breath is they take an oxygen level. You have an oximeter that you can buy in the grocery store to tell you what percentage of oxygen is in your blood, because if the virus is taking over your lungs too much, you can't get enough oxygen in. And then that's why you have to be given a tube, intubated, and have a machine breathe for you. Because you're not getting enough oxygen, you're going to be tired. Any of you who are athletes know this. You're running, you're wrestling, you're playing tennis. Your body is using up more oxygen than you can get in. And you get tired. And your muscles ache because of that. And headaches, it's all about muscles. Believe it or not, even though people like me have a very hard head, there actually is a thin layer of muscle around the head. And what causes a headache are those muscles contracting. The bones aren't hurting, and your brain isn't hurting. In fact, your brain doesn't have any nerve endings in it. So if I cut a hole in your head and stuck my finger into your brain, you would not feel it. But I digress. So headaches. This virus loves lung tissue, and it loves the nerve endings at the top of your nose that you use to be able to smell things. And taste goes away because something like 75 to 80% of your ability to taste is dependent on your ability to smell. If you can't smell, I don't know if your parents ever taught you the trick to eat your vegetables. If you held your nose and ate that spinach, chances are you wouldn't be able to taste the spinach very well because you couldn't smell. And that's the reason for that. But this virus loves those cells, and they're hurt very badly. Some of them are destroyed. Most people get their smell back, but sometimes they don't. So it's a really bad consequence for someone like me.
So Dr.
Sore
Vereen,
throat.
if you could give us about 1 or 2 more minutes, then we have to transition to Nurse
Yep.
T.
Okay.
Thank you so much.
Yeah. And the same with the sore throat, the congestion and the runny nose, all of that is because of inflammation, because the body is also trying to fight the virus off. So the last thing that the virus does is it causes such a reaction that it turns out that reaction is toxic to the body. And that's what kills some people. That's why you have to be given steroids sometimes when you have the virus, that your own immune system is it may be overwhelming the virus, but it's also overwhelming your body. And we talked about the nausea and vomiting and the diarrhea because it affects the gut. So if you look up anything related to long COVID and they tell you what happens, this list should make sense to you. Because if the virus goes everywhere, then it's going to cause problems everywhere. So your skin, it's going to cause rashes. We already know what's going to happen in your respiratory system, in your lung system. Your heart is a muscle, just like the muscles in your arm. Your brain and all of your nerves can be affected. And most important there, when you take the totality of what's happening neurologically, and then your psychological reaction to the pain and the soreness and all the bad feelings you're getting from the virus, it can cause your mood to change, your mood to go way far south, and you can be depressed either because of direct effects on the brain by the virus or because of your own reaction to the suffering that you're going through. And then once you had the virus and then you haven't, the symptoms continue for more than a couple of weeks, the doctors, by ruling everything out, will then say, okay, let's agree that you have long COVID. And what you're going to have to do is pay attention to the symptoms that you have. Everyone has long COVID in a different way. And you have to pay attention to that. You have to talk with your doctor and your nurses and all of your caretakers, and you come up with a plan to deal with the combination of symptoms that you have.
Wonderful segue, Dr. Vereen. Talk to your doctors and your nurses. And we just heard from one doc, and guess what? We got a nurse on our panel. So at this time, we want to transition over to Nurse T. We have about another 20 minutes left in the show. And so we want to give her some time to kind of talk about how she is taking this long COVID message and really engaging with the Flint community to educate them. Thank you so much, Dr. Vereen. You covered again for us and reminded us how COVID is transmitted, what it actually does in our body with our cells, and mentioned the long-term, with the effects of long COVID. So Nurse T, we want to turn it over to you and tell us about what's happening on the streets and how we're getting this information out into the community.
Absolutely. So one thing I do want to start by saying is that when you talk about the long haul effects and you talk about the impact that it has on us mentally, I still remember the day when I was at home and I got a call that I had to come to the hospital and transition my nursing unit into a COVID unit. At the time, I had 2 units. I had a 50-bed unit and I had an 8-bed unit. Of course, I wanted to turn my 8-bed unit into the COVID unit and not my main medical unit, but I did. I had to turn my medical unit. And that day was a tragic day. My mom didn't want me to go to work. My kids didn't want me to go to work. I felt like I was being deployed and I didn't know whether or not I was ever going to come back because we didn't know. And as far as being a medical unit, you know, we were used to practicing at our level. Everybody in the hospital had to rise a level. I mean, it was devastating seeing patients come in. At the time, it was new. So we were all learning together. I don't know whether you guys remember, we had a shortage on masks, but we were all putting in the work. I remember working 14, 16 hours a day, going in, caring for patients, crying, praying. The nurses, when you talk about prayer, we were lining up because it was like we would look at each other and not know if we were not going to be the ones that didn't make it home. We worked together as a team. So I wanted to start off by showing and sharing the impact of COVID and how COVID has drastically changed all of our lives. And some of us may have had COVID and had the signs and symptoms, but just was never diagnosed. So we still have a huge population of people, you know, that around that time, 2020, they didn't feel well. You know, I remember having a cold and a cough that I couldn't get rid of. And I went to the doctor and the doctor thought, oh, is this bronchitis? Oh no, is this? A Z-Pack didn't have nothing happen, helped it. So now you're looking at the community. And what's concerning is that our community is sick. Our community have a lot of comorbidities. Our community have a lot of underlying comorbidities and medical conditions that have not been diagnosed. And when a lot of the patients did come to the hospital and they were impacted by COVID, yes, the diagnosis might have been COVID, but they also had diabetes. They also had diabetes, they also had hypertension, they also had kidney disease, and they were obese. And if we know anything about COVID, COVID is like a warrior. It goes in and it preys on the weak. And when you look at our community, we are not healthy. So being out there in the community is very important to be able to educate and really now drill in why it's so important for us to be healthy and for us to put in the work to be healthy. You know, a lot of us, like, even though every time sometimes I present, I say, you know, I'm fine, and I look good, but guess what? My BMI is over 25. So guess what? I'm obese. So that makes me at risk for a lot of medical conditions. So if I get impacted with COVID, COVID loves adipose tissue. So guess what? The chances sometimes of me surviving without the vaccination was worse than me taking the vaccination and not, you know, and not worrying about the signs and symptoms of what would happen. The community, a lot of times I'm out there, they're afraid. You know, we look at the vaccinations and the push and the hesitancies, but look at how it has changed our lives. When we look at it, and I'm just going to talk practical, you know, when we talk about people that's introverts versus extroverts, you know, introverts, they don't really like to talk to people a whole lot, so they're okay. But if you're an extrovert and you're the type of person that's in the grocery store, and you know, and now you gotta be spaces behind people. Can you just imagine now that's our society? Even now we are getting better and things are changing. But think about that time when we were at the grocery store and you couldn't talk to the person that was in front of you. Think about not being able to turn and talk to the person that was behind you, or think about the stress. Now we know hypertension is a silent killer, especially in the Black and brown community. But think about stress as being the #1 cause of a lot of medical conditions. And now you're in the elevator and you got a cough. How do you feel? Because now everybody in that elevator now thinks that you are contagious. And when you look at the number of patients that came in and that we took care of, and the impact of their families, of the families bringing their loved ones in, and that probably was the last day that they ever got to see them, or they didn't know if they were ever going to be able to see them again. You know, we tried so many things. You talked about the respiratory and the lungs. We knew that if our patients started going higher than 2 liters of oxygen and they went close to 6, it was pretty soon that we were going to be intubating them. And, you know, and if you have any history of COPD, once you go on that ventilator, it's hard to wean you off. So I'm sharing all of these because why is it important? It's important because we as a community got to put in the work to become healthy, because now it's our baseline. You know, it's some medical students on here. What we always ask the question all of the time, what is the baseline? What is our baseline? Do we know our baseline? Do we have risk factors for diabetes? Do we have risk factors for hypertension? Are we doing things that can lead to that? Are we not taking care of ourselves? And why? You know, that question, why, is a very important question, because a lot of times, I can be honest, we have took our lives for granted. Like for instance, this month is Heart Health Awareness. Do we really realize that our heart is the most important organ in our body? Without our heart, we can't survive. So when we out there in the community, I distribute a lot of information. I go to a lot of places. I go to a lot of places where people probably wouldn't think to go, because it's about access and it's about mobilizing services to where people may not be able to come. Yeah, you know, sometimes downtown, I love downtown. I love the Crim. But guess what? 9 times out of 10, the people that really need to be reached are not at the Crim. They're in their neighborhoods. They're at their parks, their backyard barbecues. They're at the basketball games, the baseball games. They're at their friend's house. So why is it important? It's important for us to be able to connect to the information and meet the people where they are. I tell you, I've been a nurse for 22 years at a level 1 trauma. It has devastated me for years to be able to look in the patient's family and they ask me the question, why? Why didn't I know? Why didn't I know? Why wasn't I able to pay attention to what was going on with grandma when grandma was sitting in the chair and she was no longer going to the bed, but she slept in the chair because she was having congestive heart failure? So why is it important for all of us to be out in the community advocating? Because it's crucial. And why now? A lot of the questions be asked, well, you know, they didn't care about our diabetes. Why? They didn't care about this. And I understand historical trauma because we have had a lot of historical trauma. But guess what? Historical trauma should not be a reason to why we don't have a primary care physician. Historical trauma shouldn't be the reason as to why we don't take care of ourselves. Historical trauma shouldn't be the reason as why we blame other people. Because yes, there have been some issues, but I tell people all the time, Somerset sometimes can act funny towards us too, but they still go down there and get that Gucci bag. So it's important. It's important, especially with the youth. I can't stress enough. A lot of our youth, you guys are healthy. Your BMI is less than 25. You have a flat stomach. You know, you're in shape. So what that means is that your risk factors are reduced. You know, the doctor, he hit everything on COVID and the long haul effects. And think about too, when you think about those long haul effects, think about the compassion and having empathy, because think about people that they were active, you know, then COVID hit them and then their lifestyle changed and then they couldn't work. And then some of them had to be rehabbed and they didn't have the strength. They was isolated. Think about all of those things that happened. COVID changed our lives. You know, you go to certain restaurants now, or I went to Don Donuts today, which I shouldn't have went to, but there's a limited supply. Everybody is running out of stuff. There probably was a sign that I need.
It's the eggs. It's the eggs.
But I say all of that to say is that we have a lot of work to do. I'm thankful to be able to be out in the community. I'm thankful to be able to connect and support our community and be able to advocate. And one thing too is know policies, know procedures, and know the why. The time to find out about a medical condition or signs and symptoms is not in the middle of a crisis, because in the middle of a crisis, you can't hear. So that's why it's important. And COVID, it's smart. I mean, that's all I can say about it. It's smart and it preys on the weak. So what we got to do is we got to activate our healthcare power. We got to get it together. We got to make the decision that we're gonna be healthy, even if it's at home, doing a couple squats, anything. We got to put in that work to where we can become better version of ourselves. So
I love that, Nurse T, activate our healthcare power. Thank you so much for sharing the practice of it, the engagement in the streets. And thank you, Dr. Vereen, for kind of walking us back through the science of it. I want to open up the floor for a couple of questions and some comments. We're going to react to this information on our next show. This was really for us to kind of get some information. And I know Vanessa had some things she wanted to share, but I just want to kind of recap what the symptoms of long COVID is for the group and for those who were watching. So tiredness and fatigue that interferes with your daily life, fever, difficulty breathing, shortness of breath, coughing, chest pains, fast beating or pounding heart, known as heart palpitations, brain fog, difficulty thinking and concentrating, headaches, sleep issues, dizziness when you stand up, or feeling lightheaded, right? Feeling like pins and needles are being stuck in you, a change in the way you smell and taste, depression and anxiety. And then the digestive issues, Dr. Vereen talked about diarrhea and some stomach pain, and then also muscle pain or joint pain, as well as rashes, and also changes in menstrual cycles. So these are some of the physical effects of long COVID. So I saw Vanessa, then I saw Tomas, and then I see Dr. Bailey. Go ahead. Everyone else, can you turn your cameras on now as we continue to engage in the conversation for the next couple of minutes?
Yes, thank you. Thank you, Dr. Vereen and Nurse T. I remember the days that I worked in the ER as a physician assistant, and it's very real when patients come in there and they present. What I wanted to add is that although we talk about long-term COVID, a lot of people during the time when COVID really hit at its utmost, at its best worst crisis, we also saw that a lot of people was uninsured. There was no health insurance, there was no medical insurance, and the reality is that everyone needs to be insured. And I say that not just as an insurance producer, and I'm also licensed in Michigan. I say that because now healthcare providers are since there's no really long-term, stability with long-term effects of COVID, it's causing a lot of individuals to be uninsurable. So this is becoming a big issue. So I always recommend, if people don't have insurance and haven't had COVID, this is the best time to get it, because there's some unknown foreseen long-term effects of COVID and people are becoming uninsured. And for those who happen to have COVID and unfortunately not able to get insured, there's other ways to protect yourself and your family with the death benefit. So I would encourage everyone to look into that as well. It is something where it's not, when you're not constantly leaving a burden to your family. It's very real. Only thing that's going up is inflation, taxes, and healthcare bills. And like we say, when we talk about the community, and particularly the Black and Brown community, we present differently. So although COVID had been around for some time prior to when they announced COVID, people were just like Nurse T said, you get a Z-Pack, go home, 3-5 days, you good. But that's not the case. And people was dying as a result of that. They wasn't considered critical when they walked into the emergency room, and they was sent back home and they died there. So we got to look at all the historical components to healthcare, all the disparities that go on with healthcare in the presentation that people present, and we look at that. And I talk to the medical students that are on this panel, is that sometimes when you in the field and you actually in the ER or whatever your choice of medicine is, you have to kind of look outside the box, because some people present differently. And I know when I studied medicine, you look at certain things that they classify as the norm, but it does sometimes deviate outside of that norm as well. But I wish you all the best of luck in your medical career, and thank you, Dr. Vereen and Nurse T, for bringing us more awareness to long-term COVID.
Thank you.
Dr. Bailey and then Dr. Vereen.
Thank you, Vanessa. Thank you, Nurse T. Thank you, Dr. Vereen, for those presentations. One of the things that I wanted to bring back to people is that at this particular time, COVID vaccines and boosters are still free. But we know that come, I think it's May, these things will now be turned over to the insurance companies, and they may not be free. The average cost is going to be somewhere around $35 to $40 per shot. So for a lot of families out there, a lot of people out there, that may be cost prohibitive for you. And so this is the time now for you to go ahead and make that decision to get the shot and have your booster. I'm in Dallas, and I rode here on a plane. And on that plane, there were only 5 of us that wore masks. So other people across this nation are unmasked, which means that they are spreading not only COVID, but everything else that is a respiratory. And we know that there are all kinds of respiratory issues that are going on. I experienced COVID, which was no joke. And I had long COVID for 2.5 years, trying to function with what is known as brain fog, where you start a sentence and where you end up, you may not know. And so you're constantly asking other people, did that make sense? Did I go from A in a sequential order to B, and having to relearn how to present your speech just to each other is difficult. So there are a lot of things that come along with this, and I'm not the only one. And when it first started, many of us were talking about these symptoms, and everybody was looking at us like, you're crazy. And now we're recognizing that there's a lot about this disease we really don't know. But the best thing that I can tell you is that if you haven't had it, which I doubt that most people haven't had some form of COVID, but that if you haven't, get vaccinated. Go to your local health department or to the church where they are providing the vaccine for free before you have to pay for it. And then it's gonna be, do I eat or do I get the shot? You know, and I know you know. So I'm just warning you now. This is for your best good. Thank you, Dr. Keefe, for letting me share that.
All right, Dr. Vereen, you want to round us out?
Yeah, just two quick points to follow up on Dr. Bailey's point. If you're vaccinated, you're less likely to get long COVID. If you were intubated and were on Nurse T's service, you're more likely to get long COVID. And then there's a lot in between. So those two extremes are important. So that message to get vaccinated is an important one, because you're less likely to get long COVID. You're less likely to get COVID and you're less likely to get long COVID. But if you had a tough time of it, those are the folks that tend to go on to have long COVID. It does seem to evolve for some people. Sometimes they reach a plateau. We just don't know. It hasn't been out there that long. Last point though, if the doctors have ruled out everything else and you're diagnosed with long COVID, it qualifies for disability if it's interfering enough with your work. So in the short time that we've been involved with COVID, they've made that distinction. They've made that determination. So that's an important one to go along with Dr. Denanzane's point about insurance.
All right. Well, thank you, everyone. So this has been an awesome show for today. Again, we're going to digest this information, and then our interns will have a discussion about this in our next show. What does it mean for long COVID? What does it mean for our families? And we probably will invite some guests who actually are experiencing long COVID to really share their experiences and their testimonials, so that, again, it's real. People understand what it is and what it is not, and what they may have to do in order to continue living their everyday lives, even with the symptoms of the effects of long COVID. So again, we thank you, everyone out there in social media land. This has been another episode of A Youth Perspective. I am Dr. Ken Key. We are the Flint Public Health Youth Academy, where everything is public health and public health is everything. Have a good night.